Ayan, magandang umaga po sa lahat. Good morning everyone and welcome to today's webinar organized by the Philippine Institute for Development Studies or PIDS. I am Janina Sarmiento, Information Officer from the Research Information Department. We are delighted to have everyone with us today as we explore how the earliest years of a child's life, family, community, and social environment play a crucial role in shaping their development and future well-being. Today, we aim to provide evidence-based insights, practical guidance, and research-backed strategies that can help caregivers, educators, and policymakers support Filipino children in reaching their full potential. So before we begin, I'd like to acknowledge the presence of our distinguished speakers and panelists today. So good morning po. Their expertise will guide today's discussions. We encourage all participants to actively engage in the Q&A sessions, so please feel free to submit your questions in the chat box at any time. To officially open our program, please join me in welcoming Sir Randy or Dr. Philip Arnold Tuaño, President of PIDS.
Good morning, Janina. Good morning, everyone. Magandang umaga sa lahat. Ladies and gentlemen, esteemed colleagues and partners in research and development, good morning. It's my pleasure to welcome you to this public webinar titled Understanding How Early Experiences Shape Filipino Children's Development. As we observe this year's National Children's Month, it is fitting to take a closer look at the conditions that influence children's health, learning, and long-term well-being. Safeguarding the rights and well-being of our children is not only our moral obligation, but also an investment in the country's future. Their safety, their early development, and the support they receive within their homes and communities shape the society we will become. Let me begin by acknowledging the presence of our distinguished guests and officials, Commissioner on Population Regional Director Joyce de la Paz Silvano, Department of Social Welfare Development Director Miramel Laksa, Capital University Executive Vice President Fe Juarez, Adarna Group Foundation Incorporated Executive Director Maria Concepcion Estrella, ID Insight Associate Director Mia Jong, Philippine Association of Nutrition Incorporated External Vice President Cecilia Cristina Cuy. We are also joined this morning by participants from the government, the academe, civil society, the private sector, and media organizations. Maraming salamat sa pagpunta dito sa mahalagang pag-uusap patungkol sa bata. We convene today against an increasingly urgent backdrop of data on the state of children in the Philippines. National evidence continues to show that many Filipino children encounter significant risks during the earliest years, risks that have lifelong consequences. The National Baseline Study on Violence Against Children conducted by the UP Manila and partner institutions have revealed alarming findings. It reported that 4 out of 5 of the survey respondents aged 13 to 24 have experienced at least one form of violence in their lifetime. About 2/3 experienced physical violence, while over 3/5 reported psychological violence. Furthermore, almost 1/4 experienced some form of sexual violence. Despite these high levels, fewer than 1/10 sought help from professionals or authorities. These figures highlight how deeply entrenched violence remains within the environments where the children are supposed to feel the safest: their homes, their schools, and their communities. Alongside violence, malnutrition continues to be one of the most persistent threats to early childhood development. In a study from a recently launched book by PIDS and UNICEF Philippines, almost 1/4 of Filipino children under 5 were stunted as of 2023. Stunting caused by chronic malnutrition and undernutrition impairs cognitive development, weakens immunity, and reduces future productivity. The same book also emphasized that maternal nutrition is a decisive predictor of a child's growth trajectory. Short-statured and undernourished mothers are also more likely to give birth to infants at a higher risk of stunting, perpetuating an intergenerational cycle. Moreover, recent data from the Congressional Commission on Education show that 14% of Filipino women of reproductive age are undernourished, increasing the likelihood of low birth rates and growth faltering among infants. These numbers are not mere statistics, they reflect lived experiences that influence how children think, feel, learn, and participate in society as they grow. They remind us that early childhood is not just a development phase, but a critical foundation for human capital formation. It is within this broader context that today's webinar takes on special relevance, and this morning we will hear insights from 2 PIDS studies that shed light on the different dimensions of early experiences. The first study, titled Early Harm, Lasting Impact, the Effect of Parental Violence on Educational Outcomes Among Filipino Children, to be presented by PIDS Technical Specialist Aaron Carlos Manuel and Senior Research Fellow Dr. Valerie Gilbert T, examines how exposure to parental violence affects school participation, attendance, and academic performance. The second study to be presented this morning, titled Sustain the Gains, an assessment of nurturing care outcomes in the next 1,000 days, presented also by Dr. Ulep together with former project technical specialist Ms. Norma Thea Madeline M, Conjares, explains how development gains during infancy are either maintained or eroded during the ages of 2 to 5. We also extend our appreciation to our discussants, Dr. Alejandro Alexarin, Visiting Research Fellow of the Office of Population Studies Foundation of the University of San Carlos, Teresa Medina, Program Development Officer of the Early Childhood Care and Development Council, who will offer policy insights and situate today's findings within the broader landscape of health, nutrition, and child development. May today's dialogue deepen our understanding of how early environments shape children's futures, and may it inform policies that protect, nurture, and empower the next generation of Filipinos. Maraming salamat at magandang umaga sa lahat.
Thank you very much, Dr. Randy, for further setting the context of today's webinar. Before we move on to the discussion, we just like to do a bit of leveling with everyone and hear from you, our audience. Now, we have a quick poll to gauge your understanding and initial thoughts about today's topic. So, the poll question is now flashed. You may scan the QR participants right now and over 20 FB Live viewers on Facebook. As mentioned by Sir Randy earlier, our discussion today is very timely, as we celebrate National Children's Month. Investing in children's health and early childhood development is not only relevant, but essential to ensuring there will be in future success. So our discussion today is a reminder of our shared responsibility sa pag-support ng ating youngest learners. Dahil dito nakasalalay ang mas matatag na pamilya, mas healthy na communities, at mas resilient na bansa. So team, can we now show the result of the poll? Okay, we hope that everyone is still answering or has answered na para makita natin kung saan tayo nanggagaling or magsisimula for today's discussion. So as we can see, marami ay somewhat familiar and then followed by heard of it but not deeply. So I think marami din sa atin ay as we look into the discussions right now, marami din tayong matututunan. No? So meron ding not familiar at all and meron ding very familiar for today's discussion. So I hope that sets as well yung saan tayo or paano tayo mag-uusap-usap today sa ating discussion. So maraming salamat po sa pagsagot. I'm sure we'll have more to share later as we go through the discussion. Now, let's proceed to our first presentation titled Early Harm Lasting Impact, the Effect of Parental Violence on Educational Outcomes Among Filipino Children. To discuss this research, we are joined by the two authors to present this study. First, we have Dr. Valerie Gilbert T. Dr. Val is a Senior Research Fellow and Program Director of the Health Economics and Finance Program, or HEFP, at PIDS. He has authored numerous publications on health financing, health policy, and nutrition, and has provided technical assistance to governments and organizations, including USAID, the UN, the World Bank, WHO Geneva, and ADB. Before joining PIDS, he worked at the World Bank's DC and Delhi offices on UHC reforms in South Asia. He was a doctoral fellow at the University of Toronto and holds a PhD in health economics. Joining him is Mr. Aaron Carlos G. Manuel. Mr. Manuel is a technical specialist here at PIDS. He is a registered psychometrician and former clinician with experience in implementing drug rehabilitation programs. With over 5 years of experience in the health and nutrition sector, he currently serves as a costing and policy researcher under the Health Economics and Finance program of PIDS, focusing on universal healthcare reforms. Please join me in welcoming our first set of presenters. Sir Val, you may start.
Okay.
Good morning.
Good morning. Thank you, Janina. So, sorry, Aaron will do the presentation later, but I'll try to provide um, a brief overview of the two studies. No, so um, I just want to mention that I am the project director of these two important studies. No, which supported the Education Commission too. So I would like to first thank again the Education Commission who headed by the Executive Director, Dr. Carreon, for supporting these two important work, and of course the UNFPA for providing us with the important panel data. For providing us with the panel data. So our first study, which is an actual and empirical work, and the goal of this study is to really quantify the potential impact of domestic parental violence on education outcomes. No? So as Dr. Randy mentioned a while ago, there is really a high level of children exposed to parental violence. No? So we hypothesize in this study that there is really a negative effects on education outcomes. No? We know that there is really a negative effects of parental violence, but in this study, we wanted to quantify the impact. So for the second study, we know at PIDS we've been releasing a lot of studies, multiple studies, in fact, on the first 1,000 days of life and its impact on education outcomes, on health outcomes, on nutrition outcomes. But this time, in this study, we tried to examine where we are now with the next 1,000 days. So after 1,000 days, there is another level for the next 1,000 days. So a few years ago, there was an important seminal work published in the Lancet suggesting or encouraging countries like the Philippines that we need to sustain our achievement in the first 1,000 days. So in this work, in the second study, we try to examine where we are now with the first 1,000 days. So I'll just want to give the floor to Aaron to discuss the findings of our first study on domestic parental violence and education outcomes. So over to you, Aaron.
Hello. Thank you, Janina and Doc Val for the introduction, no? And hello everyone, and good morning. Again, I'm Aaron Carlos Manuel, and as mentioned by Doc Val, this presentation is based on a published paper, no, in partnership with the EdCom3, where we examine the relationship of parental violence and educational outcomes using the longitudinal cohort study on the Filipino child. So, acknowledging the presence of my co-authors, Mr. Lyle Casas and Dr. Val Ulep, who are present here today. And to start off, here's our agenda for this presentation. So, we'll begin with the background and study objectives, followed by the method section, results and discussion, and then lastly, conclusion and ways forward. And without further ado, let's start with the background of the study. So, the first step that we did was to look into the definition of the violence against children. And what we were able to see is that violence against children, or VAC, is any act that harms or threatens a child's health, development, dignity, or survival. So shown in the slide, this can take many forms, such as physical, emotional, sexual violence, and even neglect and exploitation. So it can be committed by anyone in the child's environment, like parents or caregivers, teachers, peers, or even strangers and community members. But in this paper, no, we focused on violence inflicted by parents, whether by physical or emotional means. And as we looked into the current state of VAC, recent estimates suggest that about half of the global child population experienced some form of violence at some point in their lives. So imagine this is equivalent to nearly 1 billion children, and um, putting it into the local context in the Philippines, what we see is that 3 in 5 Filipino children aged 1 to 14 years experience violence discipline at home. And another study highlighted that 13 to 24-year-olds uh, experience also, having experienced the physical and emotional violence at any setting, 3 and 5 then, gaya ng sinabi kanina ni Sir Randy. No? So while these certain forms of disciplinary actions may be normalized across generations, research suggests that VAC has profound and lasting effects on these affected children, not just on their health and well-being, but also on educational outcomes and economic productivity. So when we look into the economic cost of VAC, it is estimated at 7 trillion US dollars at a global scale. Meanwhile, in East Asia and the Pacific, where our country belongs, it costs up to 206 billion US dollars, or about 2% of the region's gross domestic product. And when it comes to education, theory and evidence both show that VAC can lead to poor outcomes as presented in this slide. And yeah, moving on with the gaps, since most studies on VAC rely on cross-sectional data, this limits understanding of its medium and long-term effects. Another is that several studies focus primarily on school-based bullying, which tend to overlook out-of-school children who may be equally or more vulnerable. And then lastly, much of the empirical research comes from high-income countries, creating limited evidence from low and middle-income contexts, like in the Philippines. And so, our study aims to use the longitudinal data to examine how exposure to parental violence affects children's educational outcomes. And specifically, we aim to describe the prevalence of parental violence among young adolescent Filipinos, to compare school-related outcomes between children exposed and not exposed to such violence. And just what Doc Fal mentioned a while ago, we wanted to quantify or estimate the impact of parental violence on school enrollment and academic performance in math, reading, and science. And to attain these objectives, we leverage the data from the LCSFC, or the longitudinal cohort study on the Filipino child. So this 15-year prospective cohort study tracks around 5,000 Filipino children from age 10 in 2016 to age 24 in 2030. So basically, this is a nationally representative data. And this provides us rich data on health, education, risk behaviors, and exposure to violence and other factors. And before I discuss the methods in detail, I'd like to acknowledge the hard work of Dr. Carreon and his colleagues at the USC OPS, who have been leading this cohort study for nearly a decade now. And I'd also like to thank the UNFPA for providing us the data set used in this paper. Okay, so going back for the data and measures in this paper, we covered waves 1 to 5, which corresponds to ages 10 to 14, or the early young adolescents. So basically, we analyzed the same group of children, merging data from multiple modules from 2016 to 2021, with information from both the index children and their households. So for our variables and measures, the main predictor is exposure to parental violence. and as reported by the child at age 10. No? And we define this as recent first-hand experience of either physical or emotional violence by parents in the past 6 months of the survey. Now, two primary educational outcomes have been assessed. First, we measured school enrollment during wave 5, and then another outcome is the academic performance in math, reading, and science using the most recent data from wave 4. And moving on, the background factors that we incorporated in this regression model which I will discuss later on. These included some child factors that, according to literature, may affect the outcomes of interest. No? We also included the early life factors or the baseline data of the outcomes, such as the prior school enrollment and prior academic performance. And to control socioeconomic and demographic factors, we included baseline household and household debt factors listed in the table. So essentially, we selected these covariates based on literature and data availability. And now to estimate the relationship of parental violence and educational outcomes, we adopted a model from a study in 2003 wherein we argue that educational outcomes or school enrollment and academic performance in the future are a linear function of prior exposure to parental violence and the vectors of covariates listed below. So in this analysis, since all these outcomes are binary or dichotomous, what we did was a logistic regression. So we also have 3 model structures per outcome. So one is we analyze them collectively, meaning without any stratification. And for models 2 and 3 naman, we stratified them by sex to see if there are variation between sexes. So later, we'll walk through the adjusted odds ratios for each models as we move into the results. So it's also important to note that given that this is a longitudinal study, variables in our analysis have missing data due to sample attrition. And we attempted to address this through incorporating multiple imputations by chain command or MICE with 10 imputations. So how this works is that instead of deleting incomplete cases in the usual CC complete case analysis, this technique estimates and replaces the missing values based on all the variables included in the model. So the specification is known to reduce potential bias while preserving statistical power. And now going into the results of the study, we first present the cohort from 4,952 households by their characteristics at baseline. First, the weighted sample is nearly evenly distributed by sex, with 98.7% school enrollment rates. You can also see that 2 in 10 children have low academic performance across all subjects. Another is that around 3 in 10 are underweight and are firstborn children. Aside from that, only 1.6% are children with disabilities. And finally, results from Raven's IQ highlight the mean score of 29.5. On the household head profile naman po, most of them are males aged 30 to 49 years and have completed preschool, primary, or secondary education. And on household income and residence, the data indicates minimal disparity across wealth tertias and between urban and rural areas. And then lastly, on geographical location, we can see that more than half of the cohort are situated in Luzon. Now we present the bivariate analysis, which reveals significant patterns. Basically, this table shows how exposure to parental violence varies across key background characteristics. And one thing we were able to see is that the majority of children exposed to parental violence are boys, and they are more likely to come from households where the head has completed primary, preschool, or secondary education. these children are also more frequently found in households with low to middle incomes and are predominantly again from Luzon. Another is that approximately 20 to 25% of children who experience such violence demonstrate low academic performance across all subjects compared to those who are not exposed. Yeah. And lastly, the mean IQ score for exposed children is 27.8%, compared to the 30.3% for those not exposed. So mas mababa po yung kuha nila. And now, we present the proportions naman ng children exposed to parental violence across grades 1 to 4. At baseline or wave 1, we see that about 39.5% of children reported experiencing either physical or emotional violence from a parent. And in succeeding waves, exposure remains relatively high, that is 35 and 34 in waves 2 and 3 respectively, and dropping to around 27% in wave 4. But again, for analysis, we focus primarily on wave 1 because this is the baseline measure that will serve as the key predictor of children's later educational outcomes. And so to answer our research objectives, we present the results of our logistic regression models. So the figure on the left is just a visualization of the table on the right. Essentially, it highlights that when all children are considered together, exposure to parental violence is significantly associated with school enrollment. And since the adjusted odds ratio is below 1, it indicates decreased odds of enrolling in school. And starting off with complete case analysis for school enrollment, we have two main findings. You can see that exposure to parental violence in wave 1 was significantly associated with a 57% reduction in the odds of school enrollment by wave 5 comparing to the unexposed children. So it's important to note that 57% reduction does not mean that half of the exposed children were not enrolled 5 years later. And to put this in context, for example, out of 1,000 children, where enrollment is still very high at 96%, like in wave 5, among the few who are not enrolled, a larger share comes from the children who were exposed to parental violence. So basically, mas malaki lang po talaga yung share na exposed comparing to the unexposed children. And when we analyze that by sex, we see that both boys and girls were exposed to parental violence had lower odds of school enrollment by wave 5. Specifically, 48 lower odds of being enrolled compared to unexposed boys, while exposed girls had 66% lower odds compared to unexposed girls. And suggests that the impact appears to be more pronounced in girls than boys. And moving on with another set of the outcomes, the academic performance in math, reading, and science, although we observed trends towards lower odds, these associations did not reach statistical significance. So, and again, after we address the potential sample attrition, a significant association naman with enrollment persisted only for overall sample and for boys, as shown in this slide. For all children, the odds of school enrollment remained 52% lower, and for boys, 47% lower. However, for girls, the association was no longer statistically significant after the imputation. And then lastly, when we looked at academic performance across all subjects, whether analyzed collectively or by sexes, the associations did not reach statistical significance even when we imputed the data. And based on these insights, we now proceed with a comparison of results with the existing literature to see what really are the policy implications of these findings. So in answering us first specific objective, our study revealed that about 2 in 5 Filipino children aged 10 have experienced parental violence, which is a substantial portion of the population. And this aligns with the baseline survey from the Philippines then, which reported that 3 in 5 Filipino children and youth ages 13 to 24 experience some form of physical or emotional violence in any setting. And together, the statistics highlight that violence is not only widespread, no, but also often occurs in the home. And this number is not just a matter of personal or familial harm; it has societal implications. And one of these implications, naman, is again poor educational outcomes. And as we see in this slide, research consistently shows that parental violence negatively affects children's schooling. So for physical violence, it can increase absenteeism and behavioral problems, while emotional violence has been linked to lower school enrollment. And importantly, no, these effects are not uniform, where evidence from multiple countries indicates that impact varies by sex and cultural context. For example, in Malawi, um, boys exposed to sexual violence had poorer reading outcomes, whereas girls showed diminished numeracy skills with similar sex-specific patterns reported in other African countries. Yeah. And for academic performance in math, reading, and science, we observed a negative trend for both boys and girls, but no significant associations were found even after multiple imputation. So this may reflect unmeasured factors not captured in the survey, or it could indicate that while parental violence affects school enrollment and engagement immediately, its impact on academic achievement may emerge more gradually or in ways beyond the scope of this study. And uh, coming from the findings supported by the literature, we also recognize several limitations. So first, although we control various covariates in different ways, confounding may still occur due to unobserved variables. For instance, the cohort does not include measures on parenting style, household mental health, or emotional quality of parent-child interactions, factors that may be associated with both exposure to violence and educational outcomes. And therefore, the exclusion of these variables may introduce bias in our estimated associations. Second, while the longitudinal design of the study allows for a stronger temporal interpretation of the effects, it remains observational in nature. As such, unmeasured variables continue to pose a threat to causal inference. And then finally, the measurement errors is another potential limitation, no? Particularly since parental violence is captured through self-reported measures. And as previous studies have noted, such measures may be prone to underreporting, potentially leading to biased estimates of its true impact. No? And so I know it's a lot to process given the technicalities, but taken all these together, we arrive at our conclusions. Number one, and the most relevant discussion point, is that while a child's development is expected to flourish at home, for these children, no, home is where fear and harm begin. So siguro, I just want to share that in a psychological lens for example, in the clinical setting, when it comes to psychotherapy and counseling, uh, before we arrive to a diagnosis, no, early childhood experiences are always part of the conversation with clients. So, while theoretically and practically speaking, that adverse childhood experiences shape mental health outcomes, we also see, according to evidence, that early exposure to parental violence is a significant predictor of poor school enrollment. And while our results on academic performance suggest a negative trend, the evidence remains less conclusive. And this highlights the need for further investigation. Additionally, this findings carry important implications for policy and program development, especially in the Philippines, where poor educational outcomes is a persistent national concern. Our results aim to inform policies and programs to reduce parental violence. And so we recommend the sustained implementation and expansion of nationwide multi-sectoral early intervention programs that integrate parenting education, school-based violence prevention, and community advocacy. So listed below are some examples, and I think to ensure the success, napakahalaga ng multi-sectoral collaboration, and with the leadership of the SWD and the DILG as well. Very instrumental siya since most of our services like health and social services um, um, are devolved to the LGUs. And by doing so, this will allow more comprehensive understanding of how violence really shapes learning trajectories. And with that, this concludes the discussion on our paper, Early Harm, Lasting End. Maraming salamat.
Thank you very much, Dr. Val and Mr. Manuel, for that really insightful presentation. Let's now move on to our second presentation. It's titled Sustain the Gains, an Assessment of Nurturing Care Outcomes in the Next 1,000 Days. It highlights the importance of sustaining early childhood gains during the ages of 2 to 5. This research will be presented today by Ms. Maria Norma Thea Madeline M. Conjares. Ms. Conjares is a registered nutritionist dietitian with experience in health policy development and policy research. Her technical background spans across different areas, including nutrition and physical activity, active transport, public open spaces, road safety, and the development of healthy communities and healthy learning institutions. She is currently studying for a master's in nutrition and food systems at Ghent University in Belgium, where she hopes to build on her skills and expertise for food policy and food systems transformation. Let's give her a virtual round of applause. Good morning po.
Good morning. Thank you for the introduction. I am again Maddie Conjares, previously a project technical specialist from PIDS, from the health team under
Yes,
Dr.
Maddie.
Val.
Maddie, sorry if I may, yung sa presenter view ka ngayon sa screen natin.
Oh, sorry. Wait. Hold. There.
Yan, good. Thank you.
Thank you. Okay, I am here to share with you our paper for EdCom ECCD entitled Sustain the Gains, an Assessment of Nurturing Care Outcomes in the Next 1,000 Days. This study is a part of a series of papers for EdCom ECCD, which aims to understand the barriers that relate to parental perceptions and engagement in ECCD. To get started, this will be the flow of our presentation for this morning. First, we will be discussing the next 1,000 days and how this period of development is relevant to ECCD. Next, we will be looking at our guiding framework for our study, the Nurturing Care Framework, and I will briefly discuss the methods used for our study. Then we will be discussing the relevant nurturing care outcomes in the context of the next 1,000 days. Lastly, we will be concluding with policy recommendations given our results. So what is the next 1,000 days? The next 1,000 days is the period of growth between age 2 to 5 years. So just recently, in late 2024, the Lancet has released a paper series on the next 1,000 days, citing emerging evidence that this developmental period provides a window of opportunity to build on early gains and sustain or improve trajectories of healthy development. Simply put, this period of development provides us a second chance to correct developmental outcomes in early childhood. Thus, what happens in these years can reinforce or hinder progress made in early life. So similar to the first 1,000 days, this period is a crucial jumping-off point that predicts health, nutrition, and education outcomes later in a child's life. Just like the first 1,000 days, we note that simplicity in language may be beneficial in securing commitments and investments during this developmental period. So when we hear the first 1,000 days, for those familiar, we immediately connect this to infant and maternal child health and nutrition, the same as hoped for the next 1,000 days. So it is important to differentiate the two. So the first 1,000 days is the period of conception up to 2 years of age. The interventions during this developmental period mainly focuses on maternal and child health and nutrition outcomes. And furthermore, this period of development is crucial in providing for foundational growth, and key players of this developmental period heavily focuses on mothers and primary caregivers to ensure appropriate and adequate infant and young child feeding practices. In contrast, the next 1,000 days covers years 2 to 5 of a child's life, and its interventions revolve around nurturing care, which we will be discussing in the next section. Additionally, this period is crucial in sustaining early gains for growth and development. And lastly, key responsibilities during this period expand beyond the parent or caregiver-child dyad and involves more members of the community, such as other family members and ECCD workers. So with this, we move on to our guiding framework to assess the state of the next 1,000 days in our country, the Nurturing Care Framework. The Nurturing Care Framework was developed quite recently in 2018 by the WHO and UNICEF in response to the growing commitment of global institutions such as the World Bank and UNESCO to invest in early childhood development to achieve the Sustainable Development Goals by 2030. Since the publication of this framework, there was a significant uptake globally in adopting nurturing care across ECCD policies. So why do we use this framework to assess the next 1,000 days? So this framework accommodates the growing complexity of needs in early childhood. As an infant grows up, there are necessary needs and skills that need to be taught and learned to ensure optimal growth, learning, and living. That being said, we see that the Nurturing Care Framework highlights these needs through its 5 components, namely good health, adequate nutrition, responsive caregiving, opportunities for early learning, and safety and security. So we will be diving into each component later in the presentation as we discuss the results. And we will see later how each component is interrelated and how we cannot maximize the developmental potential in one component if we leave another behind. In the Philippines, nurturing care is not new. It has existed in our laws and policies across multiple sectors for over 5 decades. We have laws that protect maternal, infant, and young child nutrition and health, such as the Milk Code, newborn screening, expanded breastfeeding promotion, feeding programs through the Masustansyang Pagkain para sa Batang Pilipino, the First 1,000 Days Law, and the Universal Health Care Act. We also have laws that enable early learning, such as the Barangay Level Total Development and Protection of Children Act, the Bright Child Program, and the Early Years Act. We have laws on responsive caregiving through the Solo Parents Welfare Act and Parent Effectiveness Services Program, and laws on children's safety and security through Children's Emergency Relief and Protection Act. Furthermore, we have overarching ECCD laws like the ECCD Act and most recently the ECCD Systems Act, which provides for the professionalization of child development teachers and child development workers. However, it is worth noting that most of these sectoral efforts have existed in silos, and for this purpose, the next 1,000 days may provide us with a skeleton to synergize and further optimize efforts for ECCD. Next, we move on to the methods used in our study. Discussions on the next 1,000 days, especially in low to middle income countries, are still limited. So through our study, we aim to contribute to the ongoing discussion by examining relevant outcomes across the Nurturing Care Framework. For our research, we employed a quantitative research design where we utilized publicly available nationally representative data from the National Demographic Health Survey, the Annual Poverty Indicator Survey, and the National Nutrition Survey to analyze relevant nurturing care outcomes. The indicators we will be presenting have been adopted from the Lancet series on the next 1,000 days by Draper and McCoy, with slight modification based on available data. In our report, we highlight disparities across wealth quintiles and geographical regions. And lastly, we employed a literature review and policy scan of existing laws to supplement our research on the next 1,000 days and nurturing care. Okay, so the first component of our nurturing care framework is good health, and it refers to the health and well-being of the children and their caregivers. So this component primarily highlights WASH outcomes, as these remain to be most detrimental for children aged 2 to 5 years. Children under 5 years old are among the most vulnerable to waterborne diseases, malnutrition, and developmental delays caused by poor sanitation and hygiene. Poor WASH outcomes in the next 1,000 days hinder improvements in developmental trajectories. As such, we looked at indicators such as children practicing open defecation, children drinking surface water, children with improved WASH access, and children who had diarrhea in the past 2 weeks. So overall, the Philippines has yet to achieve targets for WASH, especially for low-income households. So we see in the slide on the figures on the right that open defecation has virtually been eliminated among children belonging in the top 20% income households, while we see about 1 in 10 children in the bottom 40% income households to still practice open defecation. Next, we see here children drinking surface water. So surface water, according to the drinking water service ladder of the UNICEF, is deemed as unsafe water. And we see the same trend for prevalence of children under 5 drinking surface water, where children drinking surface water is only apparent among bottom 40% income households. Again, the same disparity is observed in improved WASH access, where higher income households reach universal improved WASH access, defined to be access to both improved sanitation facilities and improved drinking water services, as lower income households continue to lag behind in both age groups. And furthermore, we note the wide regional disparities for improved WASH access, which has been persistent throughout the years. Despite national progress in WASH outcomes, BARM continues to lag behind, with only 60% of children under 5 with improved WASH access. Our last outcome for good health is absence of infection, which is measured through children under 5 who had diarrhea in the past 2 weeks. Children in the bottom 40% income households consistently exhibit higher prevalence rates than their counterparts in the top 20%. Among those with diarrhea, only 37% have sought treatment. When left untreated, diarrhea can impair nutrient absorption and suppress appetite, increasing the risks of malnutrition and stunting. This contributes to the vicious cycle of poor health and nutrition outcomes in early childhood. The next component is adequate nutrition, which refers to maternal and child nutrition. Early childhood nutrition status, especially in the next 1,000 days, is a critical determinant of an individual's health status as the child ages. While health status can determine nutrition uptake at an early age, the same can be said about nutrition status in projecting developmental health outcomes. For this component, we looked at stunting, an indicator of chronic malnutrition, and wasting, an indicator of acute malnutrition. Long-term consequences of child malnutrition, especially stunting, include poor child development and learning capacity, higher susceptibility to infection, and risks of communicable diseases and metabolic disorders such as obesity, diabetes, and hypertension. In the Philippines, around 24% of children under 5 are stunted, while around 6% are wasted in 2023. Significant progress has been made in the last decades, and the Philippines is on track for achieving targets for undernutrition according to the 2023 National Nutrition Survey report. Further age disaggregation reveals that while infants aged 0 to 5 months show higher wasting rates, young children aged 12 to 49 months or above 1 to below 5 years old show higher stunting rates. The sharp increase in stunting after 12 months suggests that chronic malnutrition among children in their earlier years may be attributed to poor infant and young child feeding practices. So poor IYCF may be attributed to a deviation from exclusive breastfeeding as well as inadequate complementary feeding. Alarmingly, the 2023 NNS reports a decline in rates of exclusive breastfeeding as well as in continued breastfeeding for both up to 1 and 2 years old. So this only underscores the continued need to improve the current state of food environments, as this is a barrier to making proper food choices and poses a major hindrance in sustaining nutrition progress. The next component of nurturing care is responsive caregiving, which refers to the ability of parents or caregivers to notice, understand, and respond to their child's signals in a timely and appropriate manner. Responsive caregiving in the next 1,000 days is essential to catalyze positive developmental trajectories. For this component, we looked at the percentage of households with children aged 0 to 4 that engage in specific parenting practices daily, as well as the percentages of households with caregivers who perceived optimal parenting practices. Here, disparities across regions are apparent when parents and caregivers were asked about early stimulation activities. Regions such as Davao, Sorsogon, and Central Luzon frequently score above the national average in most stimulation types. In contrast, Calabarzon, Eastern Visayas, and Mimaropa were among the cumulative lowest. So stimulation types include playing with games or toys, named or counted things, listened to music, encouraged to explore or try new things, read or look at picture books, etc. For households that engage in specific parenting practices, only 2 in 10 households with caregivers of children under 5 are aware of the recommended positive parenting practices for each age group. Across all regions, caregivers are more aware of optimal parenting practice for the 3 to 5 age group, opposed to the age groups of 1 to 3 and less than 1 year. While responsive caregiving focuses on parent-caregiver-child relationships, such relationships and interactions are just as crucial in ECCE institutions such as preschools and daycare centers. So this is what the next component talks about: opportunities for early learning, which refers to any opportunity for the baby, toddler, or child to interact with a person, place, or object in their environment. So here we looked at ECCD attendance and ECCD facilities, and we found that at households with children attending ECCD programs, we looked at households with children attending ECCD programs, and only 1 in 10 households under 5 attend ECCD programs. Despite high reported accessibility of ECCD centers, with the national average being 87.1%, completeness of available ECCD facilities, and a generally positive perception of ECCD facilities, low attendance in ECCD programs is attributed to parents or caregivers' perception of their children being too young to be enrolled in such programs. And then lastly, we look at safety and security, which is essential to maximize educational potential in an environment that provides early learning opportunities. Early childhood exposure to violence has negative impacts on learning outcomes among children, and safety and security refers to safe and secure environments for children and their families. we look at the prevalence of children under 5 exposed to any physical punishment in the past month. So here we see that 50% of children in the next 1,000 days experience violence through physical punishment. Higher rates of punishment were observed among older children in the next 1,000 days compared to children aged 2 and under. So here is a summary of our key findings for all our components. That first, the Philippines is off track in achieving WASH targets, especially among low-income households. And then for adequate nutrition, despite being on track in achieving nutrition targets, current trends in food environments pose a major hindrance in sustaining nutrition gains. Only 2 in 10 households are aware of positive parenting practices for each age group, and regional disparities are evident for early stimulation activities. Only 1 in 10 households attend ECCD programs, and this is attributed to parents' perception of their children being too young for ECCD programs. And lastly, 1 in 2 children in the next 1,000 days experience violence through physical punishment. So to conclude, we emphasize that the next 1,000 days provides an opportune moment for healthy growth and development, representing a crucial and often overlooked window. The country has made significant strides in establishing ECCD systems, and policies and programs must recognize the interconnected nature of nurturing care to harness the window of opportunity in the next 1,000 days and provide and sustain the progress gained through investments in the first 1,000 days. As such, we emphasize that while we are cognizant of the fact that health and nutrition is foundational for optimal child development, we illustrate that the gains made from investing in health and nutrition in the first 1,000 days cannot be maximized if components such as caregiving, early learning, and safety and security are left underemphasized. And with this, we recommend the following policy actions to strengthen existing ECCD laws and policies. So first, to reinforce nurturing care across sectors and reduce inequities among vulnerable groups. First, we recommend strengthening WASH governance to address disparities, socioeconomic inequalities, and last-mile challenges in accessing WASH persist, and this can be addressed through robust governance. This means there is stronger coordination across levels of government with the national government as the steward, and accountability of local government units is ensured. Specifically, institutionalized WASH governance framework to define and delineate roles and responsibilities of key actors in WASH access, establish dedicated WASH local development offices within the ILG for sustained coordination and accountability, advocate for cabinet-level policy issuances to prioritize WASH investments in GDAS and poor communities, and support developing low-cost technologies for remote and underserved areas. Second, primary healthcare services should continue to be expanded and critical food system policies should be adopted. This study noted persistent issues in child health and nutrition, which can be attributed to poor access to healthcare and poor food environments. Specifically, expanding PhilHealth's Consulta or the primary care benefits, particularly for vulnerable households and children, to ensure access to comprehensive, coordinated, and convergent health and nutrition services in communities, and to foster healthy food environments and promote healthy behaviors through reviewing the milk code, promoting IYCF, stricter regulations against harmful marketing of unhealthy food to children, and development of consumer protection tools such as menu labeling and front-of-pack labeling. Third is to promote optimal parenting. Primary caregivers should be engaged in early learning practices for children aged 2 to 5 through promotion of home-based, play-based, and developmentally appropriate learning for this age group. Early identification and care of children with special needs should be prioritized, and a targeted behavioral change and communication campaign may be beneficial, especially across regions. Lastly, to create a comprehensive child anti-violence campaign, the ECCD the ECCD Act provides an opportunity to enhance the functionality and accountability of agencies responsible for promoting child safety and welfare. As a devolved function, the Barangay Council for the Protection of Children is the local body mandated to formulate policies, programs, plans, and activities that promote child safety at the barangay level. So the national government should launch ECCD anti-violence community campaign that promotes the messaging that physical punishment is harmful to the development of children under 5, involve family members and members of the community in caregiving, and utilize primary health care facilities as entry points for early identification and response for violence prevention. So that concludes my presentation for today. We hope that our findings can further strengthen ECCD action in the Philippines, especially to consolidate our efforts for nurturing care for all our children. Thank you.
Thank you very much, Mary, for that very comprehensive na study, cross-cutting talaga, and for sharing as well your assessments. For our 248 Zoom participants right now and over 50 Facebook viewers, please do share your thoughts using our official hashtags for today. Hashtag PIDS webinar, hashtag child development, hashtag nurturing care, and hashtag National Children's Month. Join the open forum by sending your questions through the Zoom Q&A box or the FB comment section. Please include na lang po your name and organization. Replay on demand is also back. For Facebook viewers, you may still earn an e-certificate by scanning the QR code and answering a short quiz until 10 p.m. tonight. Zoom participants will receive their e-certificate after submitting the feedback survey. Please stay until the end for full instructions. At this point, let us first hear insights and reactions to the first presentation. We are honored to have with us Dr. Alejandro Herin. Dr. Herin is currently a visiting research fellow at San Carlos Office of Population Studies. He holds a PhD in economics, specializing in the economics of health, nutrition, population, and human resources, with years of professional experience in health and population policy development, monitoring and evaluation of public programs, and local governance for health. He retired as a professor from the University of the Philippines School of Economics. Dr. Herin, the virtual floor is now yours.
Thank you. I have requested organizers to move the slides for me. So at some point, it might be disruptive when I say next slide, but so far I haven't mastered the skill of moving slides during presentations. So please bear with us. A number of key points, discussion points, the next slide. But we look at recently several studies sponsored by PIDS that show exposure to violence among children is associated with poor educational outcomes. And while we understand what the outcomes are, easily measured and understandable, so they are either scores in standardized tests, enrollment, missed classes, school grades, or on track in schooling. There's also certain certainty about the concept of exposure or violence against children, at least as mentioned in our national legislation. What is not clear is how close are we in measuring that concept, or even a broader concept that is often adopted internationally. And would different measures of violence or bullying affect our analysis and conclusions? And well, what other studies can we do? Researchers often end up that way. More research needed here. In the next slide, just briefly, there are two studies, one by Orbeta and Company, looking at the results of the Program for International Student Assessment, 2018 data, and look at relating the experience of bullying with the standardized scores in reading, math, and science. And also, Abrigo and Company, using the 2022 PISA data, look at exposure to bullying and relating that to learning loss with implications for future economic productivity. Our team at the University of San Carlos Office of Population Studies look at data from the longitudinal cohort study of Filipino children. The data there about bullying, we look at individual concepts, bullying by parents, by adults and classmates, physical as well as emotional. And finally, our last study, which we just heard, looking at exposure to parental violence, and exposure to parental violence in this particular case, using the same data as the cohort study, combines the physical and emotional. And they relate this to indicators of education outcomes that includes, one is enrollment and grades in science, math, and reading. The grades are coming from the cohort study and not from PISA. So they're also different measures. In the next slide, what we want to see is whether, first of all, what is the concept of bullying or violence against children? There are mentions about what it is in an international literature. But let's take a look at what our legislation say, because that's what will guide us from a policy standpoint. So one is the Anti-Bullying Act of 2013. And what it says there, what defines bullying in terms of first, the characteristics of the act. It's severe, it's repeated, it can take several forms, written, verbal, or electronic expression, or the traditional physical act. And another factor there, the characteristics, is that it causes fear of physical harm or emotional harm or damage to property. It's either fear or actual consequence. And this includes acts of physical violence, damage to the emotional and psychological well-being of the victim, and cyberbullying. There is another law, and that's what Manuel and Ulep was mentioning. The next slide. The Violence Against Children and Women, Republic Act 9262. And here it mentions both for women and children, but here with respect to children, a series of acts. So that requires repeated acts that results in physical, psychological harm, and also economic abuse. So there are many aspects of this, as Aaron has mentioned, but we look at, especially for young children, the physical violence part and the psychological violence. So that's what the law says, but in the international literature, they have these two other, or maybe three defining concepts. One is the intention. The other one is repeated acts. And thirdly is the consequences. That includes psychological and emotional consequence. So far, we are looking at the education outcomes. We still need to look at the other kinds of consequences, at least from our own data and analysis. Now, just a quick review of the way bullying and violence is measured. The next slide. The Orbeta-Abrigo studies using the PISA data. The way that they have worked this out internationally is to construct an index based on the questions in the questionnaire. And based on that index, they examine, in the case of the 2018 or beta, look at the index, and any index that is above the threshold, which is the average of OECD countries, can be considered exposure to bullying. Similarly to the Abrigo studies, what was constructed there is again an index of most bullied, again comparing this with other countries. So there is a benchmark by which to compare it with other countries, and that is necessarily so because they're dealing with comparison of results across the 181 countries that were participating in the PISA study. Our own work with the team in Office of Population Studies using the longitudinal cohort study look at specific questions of bullying. There were questions on physical bullying by parents, by adults, and by classmates and friends. And there's also 2 items of emotional bullying or feeling hurt by parents and by classmates. So each specific response was analyzed and related to educational outcomes. As I mentioned, in the current study that is just presented, the exposure to parental violence is measured in terms of the combined physical and emotional violence. Looking at the exposure when these children were age 10, and then looking at the effects on educational outcomes a few years later in another survey. So going back, the next slide. In the international literature, as I mentioned earlier, there is intention, there is repetition, and there is consequences. We have looked at consequences in terms of educational outcomes, and to some extent in the Abrigo study, economic consequences in the long term. Now, in another study of the longitudinal, this is wave 6, which is not really included in Ulep's and Aaron's study, and also not included in our. But there are specific questions regarding intention and repetition. So the intention is more perception. I think the questions, do you think that the bullying they did to you was mostly done intentionally? And then the repetition is in instances when you were bullied repeatedly by the same person. Of course, the repetition is also contained in the broader data set. When we look at individual surveys, that same person, we can count how many surveys he says he was bullied. So that's the frequency across the different survey waves. We have some such analysis, but not reported, and so on. So repetition and intention, and this is the result that was worked out by our colleagues at the University of San Carlos, OPS. Of the bullied, how many reported that they were not done intentionally, that they were not done repeatedly, that they were done intentionally and repeatedly, and so on. So the net result is from that 19% prevalence, combined physical and emotional, only 4% or 5% are what might be considered true bullying, meaning you have both the intention and you have both the repetition and so on. So what does it matter? What measures do we have? This is a lower percentage, but does the higher percentage that we have been working on matters? So I guess it's up to the one bullied and the one bullying. What is it in their minds, and how what is in their minds is what affects them emotionally and psychologically. In the next slide, we look at the usual consequences in the international literature, especially on the emotional side, other than education. So that's depression, anxiety, low self-esteem, change in eating patterns, and loss of interest. And these are some things that we probably need to do more and relate that to bullying and child violence. We need to replicate the studies in the international literature. There are studies on this, but we probably need to have our own to add not only scientific evidence, but to put it in a local context so that children and parents can relate to it. And this will also help us get insights as to how to implement the existing laws, especially coordinating between the Anti-Bullying Act, the Basic Mental Health Education Act, and Violence Against Women and Children Act. So those are things that we need to do more, and working on the consequences on the emotional and psychological side. And the longitudinal study also has, in subsequent waves, collected data on that, but not yet related to violence against children. So that's something that can be done in future. So in the next slide, these are some of the references I mentioned. And with that, thank you very much. Mabuhay.
Thank you very much, Dr. Heron, for those thoughtful insights. No, we now proceed to the reaction for the second presentation. Our discussant is Ms. Maria Teresa Medina. Ms. Medina holds a degree in kindergarten education from St. Joseph's College of Quezon City and has earned graduate units in special education under the MA Education program at the University of the Philippines. With over 35 years of experience in education, she has served as preschool coordinator, assistant principal, and principal in a private exclusive school for boys. She joined the ECCD Council in January 2025 as technical assistant to the executive director, program development officer, and team lead for the Infants and Toddlers Early Development Program. A passionate early childhood education advocate, she considers her greatest achievement being a devoted mother, wife, and sister. Let us all welcome Ms. Medina. Good morning po, Ma'am Tess.
Hey, good morning, everyone. I'm very happy to be with you this morning. So I will share with you what we have collaborated with Dr. Inshong and my fellow program officer from the ECCD, so Ms. Jolly Yao. So to give you our general comments and reactions, the ECCD Council affirms that the report aligns strongly with the strategic direction mandated under the Republic Act 12199, or the Early Childhood Care and Development System Act of 2025. We note that many of the recommendations align with the Council's ongoing work, particularly in strengthening ECCD governance, expanding parent education programs, professionalizing the ECCD workforce, and enhancing early learning quality through standards and monitoring. The Council appreciates the study's emphasis on the next 1,000 days as a critical and often overlooked developmental period, and we support the call for systems-level improvements across nurturing care domains. The study highlights as an essential yet undervalued window in child development. The emphasis on the next 1,000 days significantly strengthens current discourse on early childhood development, while the first 1,000 days remain crucial for survival. The study appropriately points out that development gains cannot be sustained if caregiving early learning, safety, and security between ages 2 to 5 are neglected. This framing is a valuable contribution to policymaking and should inform how RA 12199 is operationalized. The three major findings are accurate, well supported, and highly relevant to current challenges. The large gaps in positive parenting knowledge, low ECCD participation despite facility availability, and high rates of violence at home, particularly physical punishment of 3 to 4 years old. Recommendations are comprehensive but demand strong institutional coordination. The proposals on WASH, food systems, expanded primary care, early learning outreach, and anti-violence measures align with global frameworks. Nurturing Care Framework by UNICEF and WHO guidelines. However, these recommendations require more technical adjustments. They necessitate institutional leadership, proper delineation of roles, and accountability mechanisms across sectors, particularly for devolved functions. The study correctly highlights that increasing ECCD enrollment is not only a supply issue. Cultural beliefs that children are too young to attend CDCs remain persistent. The recommended twin strategy, national awareness campaign plus community outreach, is an excellent solution. This is exactly the kind of approach that can shape caregiver behavior, correct misconceptions, and promote consistent participation. The WASH recommendations are strong and well grounded in governance realities. The most compelling insight is that persistent WASH inequity is not merely an infrastructure problem but a governance issue. By calling for a WASH local governance framework, better monitoring, and a dedicated DILG office, the study confronts long-standing fragmentation in responsibilities. This is timely and actionable. The Council agrees that WASH remains a major determinant of children's developmental outcomes. While WASH infrastructure is primarily the responsibility of the LGUs and sectoral agencies, the Council already integrates WASH requirements into the standards and guidelines for center-based ECCD programs, including provisions on age-appropriate toilets, safe hand-washing stations, and drinking water standards. WASH-related indicators are likewise embedded in the ECCD checklist for both homes and CDCs in line with the RA 12199. The Council's further mandated to set and enforce minimum standards and encompassing water, sanitation, safety, and hygiene provision in every CDC. In this regard, the Council supports the recommendation to clarify and strengthen WASH governance, particularly in the role of LGUs, in ensuring safe and compliant facilities, and welcomes enhanced interagency coordination to harmonize WASH provisions across ECCD settings. The proposal for anti-violence programming in CDCs and communities is critically important. The Council supports PIDS findings that violence in early childhood remains a significant concern. The Council reiterates that the ECCD standards already include policies on child protection, supervision, and safety, and that child development workers and teachers are trained to recognize signs of abuse, neglect, or violence, and to follow established referral pathways. Consistent with RA 12199, aligned with the Council for the Welfare of Children and the DSWD. In this regard, the Council fully supports PIDS' call to strengthen positive parenting interventions and to ensure that all children grow and learn in safe, nurturing, and non-violent environments. The recognition that CDCs are ideal platforms for promoting positive discipline and reducing violence is particularly insightful. It is also appropriate that the study highlights father engagement, strengthened referral pathways, integration with PHC services. Violence prevention must indeed extend beyond the centers into households and communities. Reform supplemental feeding program, expanding and reform of supplemental feeding program to address persistent malnutrition and ensure equitable access to nutrition services. The SFP should be expanded beyond child development centers. Currently, only children enrolled in CDCs benefit from the program, leaving out thousands of vulnerable young children who are not enrolled due to distance, cultural beliefs, caregiver availability, or lack of awareness. Expand SFP coverage to include community-based feeding for non-enrolled children, implemented through barangay health stations, community hubs, or mobile ECCD services. This ensured that all nutritionally at-risk children, not only those enrolled in CDCs, receive adequate dietary support during the critical ages of 2 to 5 years old. This expansion aligns with RA 12199 mandate to deliver inclusive, equitable early childhood care and development services. Responsive caregiving is essential but underemphasized in nurturing care. The Council agrees that responsive caregiving is a crucial yet underemphasized component of nurturing care. We highlight that the Council's implementing capacity building programs for our child development workers and teachers are on responsive caregiving, play-based learning, developmental milestones, and early stimulation. The ECCD checklist also incorporates caregiver practices on early stimulation indicators under RA 12199. These efforts are mandated and expanded, making parenting education a national responsibility across LGUs. Improving access to quality and early learning opportunities. The Council acknowledges the low ECCD participation rates highlighted in the report. While access to ECCD facilities is generally high, attendance remains low, largely driven by the prevailing perception that children are too young to attend as reflected in the APIS 2024 data. Improving ECCD demand therefore requires intensified social behavior change, communication efforts alongside stronger LGU, commitment to promote early learning. The Council also emphasizes and mandates that the establishment of one CDC per barangay strengthens LGU governance structures, and formalizes the professionalization and deployment of child development workers and teachers, all of which directly address the system gaps cited in the study. Therefore, we concur PIDS findings on the need to improve the availability and quality of learning materials, both in homes and in CDCs. For our conclusion, the ECCD Council expresses its appreciation for the comprehensive and timely analysis presented in the discussion paper. The Council is encouraged that the report's recommendations align with the strengthened mandate provided under the RA 12199, Council's ongoing initiatives to enhance early childhood development outcomes nationwide. Its recommendations complement the law's objectives, especially the push for interagency coordination, inclusive early learning programs, and stronger community systems and nurturing care principles. That we that will be all for the ACCD Council. Maraming salamat po sa lahat. On behalf of our Executive Director, Dr. Teresita G. Insyong, this is Ms. Tessa Medina. Mabuhay po tayo.
Thank you very much, Ma'am Tessa, for that really insightful and engaging na discussion. At this point, we will now open the floor for questions and comments from the audience. Participants on Zoom may type questions on the Q&A box, while for our FB Live viewers, please send your questions in the chat box or in the comment box. Our presenters and discussants will respond to your inquiries later. To guide us through this part of the program, I'd like to turn over the floor to Director Melinda Quinones, Department Manager of the Research Information Department here at PIDS. May I also request our presenters, co-authors, and discussants to open their cameras. Ma'am Mel, you may now take the virtual floor.
Thank you so much, Janina, for hosting today's insightful and very interesting webinar. And also allow me to thank Dr. Hirin and Ms. Tess Medina for being with us today as discussants, and also to our presenters, Dr. Val, Mr. Aaron, and Ms. Maddie. Thank you so much for sharing your findings with us. So both studies say the same thing in different ways. We're helping children early on, but we're not supporting them enough as they grow. So it is costing them their future. So even if kids get nutrition in their first years, many still face poor caregiving, limited early learning, unsafe home environments, and even violence. So before we proceed with our Q&A, may I ask the presenter's response to our discussant? So let's start with Mr. Aaron, Ms. Maddie, and then Dr. Van.
Okay, thank you, Ms. Mel. So thank you so much, Dr. Harry, for your insights, comments, and basically you synthesized the policies and even the variables that we need to improve our research study. So first, I think one of the things that I got there is that there's bullying. It's very important to see this indicator, given na yung sa amin kasi parental violence yung ginamit, and then for future research, I also saw with the Q&A questions that yung disaggregation of data, since we love the data, it's very important to see other data, like in domestic violence, whether children witness physical or emotional violence at home, and whether bullying in general, like in peers in school, mahalaga yung data na makita natin, and we compare it to several outcomes, just like what you listed, like for mental health, there's depression and anxiety, low self-esteem, changing in eating patterns, etc. So, well noted on our end as well from the uh, just adding the since relevant here, a comment from Dr. Judith Borja, yung question niya from the Q&A. Um, again, yung witnessing violence. So, given that with the UNFPA, we have this opportunity uh, to explore the data. Mahalaga na we see very detailed indicators on this in the next research opportunity. And again, maraming salamat, Doc Harry, for that.
Thank you, Aaron, for that response. Miss Maddie?
Yes, thank you. Thank you to the ECCD Council for your reaction to our paper. And I'm very glad to hear that our findings are strongly aligned with the efforts of the ECCD Council. And I do agree that institutional change is necessary for these changes to happen. No? So I'm very happy to hear how our findings are aligned with the current direction of the ECCD Council, and how the next 1,000 days as a concept can contribute to further strengthening their efforts.
Thank you, Maddie. Dr. Val?
Thank you, Ms. Mel. Nothing much naman, but I want to thank Dr. Harin. First, I want to thank Dr. Harin for really providing an important analysis or observation when it comes to measuring the construct. No? Even globally, there is really variation when it comes to measuring violence, bullying. So I think it is important to really kind of dissect these different measures or different ways on how we see the construct, in this case, violence, because this will have empirical implications, this will have operational implications. So, and as I've said, even at the global level, there is different ways on how we see bullying. And I think my colleagues at PIDS have looked into this, on how we measure or how we define bullying. So I would like to thank Dr. Arin for really providing a very smart and comprehensive way on looking at how to measure these constructs. And as I've said, these have operational and empirical implications. And I think Dr. Borja also mentioned this, that there is also a different way of looking at violence by, for example, by mere observation of, or by witnessing, for example, a violence. So these have all implications on the measurement. But I think what is important is now, as a country, with this UNFPA data, we were able to see at least some of this important aspect of violence. And we know it's a very rampant thing in the Philippines. As you may know, if you look at the PISA, for example, survey, tayo yung number one when it comes to bullying. We are the epicenters of bullying. So I think it's really important to do more analytical work when it comes to bullying. I guess most of us are quantitative researchers, we're economists, but also we are encourage other researchers, epidemiologists, sociologists, to look into bullying, because there is like deep cultural and contextual bearing of this construct. So again, this is just a small part of the effort to understand violence, at least from our end economic perspective, but there is huge need for other fields to look into this. So I think yun lang muna, Ms. Mel, but again, thank you, Dr. Karin. And I also want to thank Ma'am Teresa for providing us with the current efforts of the ECCD Council, and we are very happy that these findings, that we have aligned with the efforts of ECCD Council. Over the years, we've been working together, to help the Education Commission, but looking forward din po sa future partnership with ECCD Council. So yun lang po, Ms. Mel. So thank you.
Thank you, Doc Val. And I note, no, yung cultural perspective talaga natin, Filipinos. Tama naman si Ma'am Tess, no, when she mentioned a while back na yung mga bata, tingin natin sa kanila, bata lang sila. So they don't understand what's going on. And yun yung pinagmumula, no, some of these issues like bullying and all sorts. So I have a few initial questions here directed to our two presenters. So I'll go first with Aaron, Mr. Aaron. And then if Dr. Val would want to add up to the answer, no? So the first question would be, which current national policies or programs could best integrate your findings, and what concrete adjustments would you recommend to strengthen their effectiveness?
Okay, so if I may, thank you for that question. And as we recommended, the sustained implementation and expansion of nationwide multi-sectoral early intervention programs, nakita namin there is this, gaya ng binanggit kanina ni Doc Carreon, there is the RA 9260, which is the Anti-Violence Against Women and Children Act. There's also the Anti-Bullying Act. And to strengthen this, I think what we could recommend concrete steps. No? First, siguro for parent or caregiver programs, there is this workshops we could give, we could give to them na tied with like 4-piece cash grants para umattend sila. No? So mahalaga rin na sa kanila yung mga empirical data, yung consequences of consequences of violence, for example. And it's so aside from, I think, sa parents, mahalaga rin for school, sa school. Doon naman, I guess, what we could do is train them as well, no? So basically capacity building for the teachers, no, para they can identify children na may signs of parental violence if that is possible. So kung hindi man kaya ng teachers, they could, I think, refer to social services or counseling services, to the DSWD, etc. And then I think last siguro yung to integrate them and to strengthen yung policies and programs. Mahalaga na meron tayong quality data. So yung integration nito, mahalaga rin yung leadership ng DSWD and again ng DILG, since devolved functions ang social services din. So I think that's my answer. Thank you.
Thank you, Aaron. Dr. Val, would you want to add?
So just to add what Aaron mentioned, there are already existing laws to address the violence, so Anti-Bullying Act and other important national legislation. But I guess I want to emphasize what Aaron mentioned a while ago, the importance of referral system in this case, and the role of a strong primary health care when it comes to this referral system. So based on our conversations or discussions, for example, in rural health units, they play an important role in, number one, providing advice and even diagnose when the child is really exposed to violence. So number one, prevention through parental advice, and there is suspicion or suspicion of violence, they should be able to do that. No? Yung primary healthcare facility, and they should have a strong referral system to, for example, to authorities when they were able to diagnose that this child is really exposed to violence. So again, it's important that the primary healthcare facility should have the ability to provide advice, knows when the child is really exposed to violence, and there's a strong referral system to different agencies, local authorities, for example, or DSWD, when the child is really exposed. So again, it's really a network of, again, this is the multi-sectoral ecosystem that we need to have, because hindi lang iisa kasi yung pwedeng mag-address ng violence, but the importance of primary healthcare is critical in this case because siya yung mag-navigate sa buong ecosystem. So yun, I think there are efforts, for example, in DOH before on how to do a systematic way of referral system, not only at the hospital level, no? Kung nagkasakit ka, yung primary healthcare kasi is i-refer ka sa hospital kung hindi kaya ng rural health unit. But I guess it's also important that the primary healthcare should have a mechanism to refer it to non-health facility, right? So those are important aspects that needs to be in place sa baba. So just to reinforce what Aaron was mentioning a while ago on the referral system, both within the health system and across different agencies. So yun lang po, Ms. Mel.
Okay. Doc Val, I'd like that you mentioned, and also Aaron, about having early diagnosis sa school level pa lang. I'd like to ask ECCD about the current counselor to student ratio, kasi I've read somewhere, no, sa isang balita that DepEd reported na 4,000 licensed guidance counselors nationwide lang ang meron tayo as of 2022. And then that translates to roughly one guidance counselor per 14,000 students. So paano po ba natin hinahandle, or what's our plan sa ECCD to address this backlog?
Okay, for ACCD po, that's very sad to say that we don't have an assigned guidance counselor for the center. So that has yet to be realized in the future. What we do is, for example, for children who have special needs, we have collaboration with the municipal or city social work development office or officers, so that we can refer the children who are with special needs to proper developmental pediatrician if needed, and if they need therapies. Okay, there are LGUs who have intervention centers, and examples of this are QC and Parañaque. They have psychologists in their intervention centers, but just like what I've said, we have yet to realize that we really aim to have intervention centers like that in all LGUs.
Oo,
Okay,
sana
yun po. Very sad to say, we don't have a designated guidance counselors or counselors or psychologists in our child development centers. What we do is we collaborate, or we coordinate with the social work offices, so that if interventions are needed, we closely coordinate with the social work office.
Thank you, Ma'am Tess, for clarifying that. Sana magkaroon na, no? At,
Yes po.
oo, kasi I heard, no, parang yung mga nagre-require ng developmental pedja expertise ay 1 year pa ang scheduling
Yes.
ng
6
ganun,
months.
oo,
of
ganun
one
ka,
year.
yung backlog natin. sa mga DepEd. We have a question here from Miss Maria Rita Nicole Paterno of Nancy Care Services, and her question is directed to Miss Maddie. What are the reasons for the low awareness of positive parenting practices? Same question also for carrying out early stimulation activities.
Yes, thank you for that question. I think the low awareness of positive parenting practices may be attributed to low access to appropriate information, and the same can be said for early stimulation activities. And also, for early stimulation activities, it is possible that maybe these parents don't have access to the necessary materials for stimulation. If you look closely into our data, some of the stimulation activities include reading books or playing with toys. So maybe these parents don't have access to these materials. That's why they report that they do not do these activities.
Miss Mel, can I add to
Yes,
that?
please.
So I think that's very important, no, yung sinabi ni Maddie kanina, kasi lumalabas din sa study natin a year ago yung on stimulation, and that there is really a systematic difference, no, on the level of stimulation between the poorest and the richest, no. So yung mas mayaman, sila yung mas mataas na na chance na mag-engage to early stimulation, etc. Compared po no sa mas mahirap na mga families, no. So again, it's related again to access to these very important like learning materials, information, etc. So there is really a systematic difference, no. Hindi lang po hindi mayaman o mahirap, malaki talaga yung gap ng pag-practice ng mahirap at mayaman because of this access to materials and information.
Thank you, Doc Val. Bigla ko naisip, because nabanggit mo mayaman, mahirap, magkaiba yung kanilang Now, I remember because middle-class parents are busy at ang malimit na nagiging nanny ay ang cellphone and gadgets. Dr. Hirin, would you want to comment on that? Ano nangyayari pag ganong klaseng stimulation activities ang meron tayo?
Yeah, let me respond to that first question about coordinating all of these various initiatives. I have in mind how do we deal with some of the consequences of bullying or child violence. We have, as we mentioned, several laws already. You have the Mental Health Act, which provides for outpatient care in communities. So that is an area where adolescents can actually go to, and their parents as well. But the problem there is you need to be accredited to do that, and the accreditation process is slow. I think there are only 2 facilities that are accredited now, and they are hospitals, not the outpatient. Then you have the Anti-Bullying Act itself. There are many things there that it says, but what struck me is to take advantage in the implementation of highlighting the preventive aspects, and that preventive includes parent activities. Now, if the school can link up with the community, the school children and the parents, we have institutions like PTA and all of those parenting guidelines that we have. Maybe that would be the vehicle by which the implementation of the Anti-Bullying Act could be enhanced further. Then there's this new law, the Basic Mental Health and Promotion of Well-Being Act, which is 1925. Now, one of the provisions there is really what was lacking, that was mentioned earlier, the lack of guidance counselor. So that law provides for increasing the number of guidance counselors and things like that. So there are these different laws, and the question is, if we want to implement it, how do we implement it in scale? How do we make sure it reaches our adolescents and so on? And most importantly, who's supposed to be in charge We don't like violence, but sabi nila, sino yung papaluin natin pag hindi nangyari yung mangyari? Over.
Yeah, thank you, Doc Herin. So my follow-up question kanina dun sa answer ni Doc Val, sana Doc Herin, no? When parents give their kids yung mga gadgets na ito for stimulation as part of their stimulation activities, is there any study that would say is it good, is it bad, or what can be done? Dr. Herin?
That's complex because the whole issue about the gadgets, it's related to social media, and then you have studies that says that can be harmful, especially for mental health, when kids are not ready to respond to all of this. Actually, a lot of the cyberbullying occurs using the media. So the children have to be prepared for that kind of onslaught, and they cannot just be left to themselves. So that's why this mental health promotion of well-being in schools might be a good occasion to prepare them for this is going to be happening, and what are the dangers, and how do we protect children from these dangers.
Thank you, Dr. Herin. I have another question for you. This question is from FSL Advocacy. Language deprivation among deaf children is now recognized as a form of systemic violence, and recent laws like RA 12027 and RA 12199 remove the first language of deaf children from early education and kinder to grade 3. Your study mentions children with disabilities. So what are your thoughts or recommendations on addressing language deprivation and its broader implications for their safety and development? This question is addressed to you, Dr. Herin.
The language problem is, I'm not too familiar with that particular aspect, but one of the things that was discussed in past is this mother tongue program, and the question was, did it work, or and so on. So that it's a complex issue, and it brings to the bigger question: what should be the first language? The problem is we have so many languages.
Yeah.
So that for me, that's still a complex issue that needs to be addressed. But the lesson is slightly related, but the lessons we get from how the Japanese educate their kids, the first 3 years is really no academics, no, it's just empathy, getting along with others, and so on. And I suppose any language will do, even sign language, or a smile, or a blink of an eye, or something like that. But this is much more complex than I can handle at this moment.
Okay, thank you, Dr. Herin. May we hear from Ma'am Tess regarding the FSL advocacy question, no, about the deaf children for early education?
Yes, we do have inclusive provisions for our deaf learners, and especially for those students with special needs. Okay, so we are currently capacitating our child development workers and teachers on how to handle children with special needs. So the capacitating is ongoing, and we have a specific program for the prevention, early intervention, and for children with delays and disorders. So we are currently rolling out that program of ours to different regions and municipalities and cities in our country. So we really advocate for inclusivity, and we try our best to answer the needs of these children. May I also add on the early stimulation programs or activities? The council is currently rolling out the infants and toddlers early education program. So we are training different LGUs and workers and teachers on how to handle infants and toddlers. So in that program, we also include the responsive caregiving and the parenting, positive parenting topics so that we can answer the need to really educate our parents in the communities. Marami pong hindi pa nakakaintindi nito. And sa pag-ikot po namin sa buong Pilipinas, even on our ranks, kahit po yung mga government officials, they really don't understand and they don't really appreciate the importance of intervention sa infants and toddlers. So ngayon po, massive yung aming training para dito. And that will all hopefully answer yung need natin talaga, yung ating kailangang gawin na i-educate po yung mga magulang on responsive caregiving and positive parenting.
You mentioned kanina, no, na Ma'am Tess, about the lack of information and kailangan talaga natin to
Yes.
advocate for it. Dr. Val?
Miss Mel, just to add to the discussion on death deprivation, no?
Yes.
And this is the importance of a strong primary health care,
Yes.
no? Because there is a study na maraming bata ang number one, hindi nakakarinig. Maraming bata ang hindi nakakakita, no? And marami ding bata ang hindi nasi-screen, whether they can hear properly or whether they can see properly, no? So importante na ma-screen yung mga bata, no? And provide the necessary medical intervention or clinical intervention so they can participate in class, no? So for example, kung hindi nakakarinig, so will they be provided with hearing aids? Pag hindi nakakakita, there is provision for eyeglasses, no? So again, the importance of a strong mechanism to diagnose the issues of children, no, when it comes to learning. There was a study noon sa EDCOM na madami talaga, at least ito yung the latest na ng EDCOM is vision, no? And I assume there is also a big chunk of our learners ay hindi nakakarinig ng maayos. So hindi sila nakaka-participate sa eskwela. So that adds again to the issue of learning disabilities, no? So just want to put it out there na there is really a discussion on how to diagnose the children when it comes to hearing and vision.
And then yun pa yung nagiging cause ng bullying, no? Kasi hindi sila nakakarinig or hindi sila masyado nakakakita. So yung nagiging another way kung paano sila nabubully at an early age. We have another question on Zoom. By the way, our participants on Zoom, pwede po kayong magtanong sa Q&A box, and then our speakers and our guests can answer directly, no, on Zoom. So ang question ay from Ricardo Nolasco of Talaytayan MLE Incorporated. This is addressed to Ma'am Tessa of ECCD. How do you address the challenge of parents believing that their children are too young to attend ECCD activities? Are parents correct in believing so?
Okay, so based on our experience, for example, in this infants and toddlers early development program, so we also train our teachers and workers on how to campaign. We ask them to create an action plan on how are you going to go about the program. So marami pong mga success stories naman na when they do mapping sa kanilang mga barangay at sa kanilang mga purok, purok, nakakapaghikayat din po sila through house to house, through orientation, nagkakaroon po sila ng mga initial activities para maengganyo itong mga parents natin. In the case of Cainta and Batan, nagkaroon po ng isang study ang ARNEC, yung Asian Regional Network on Early Childhood Education, with the help of UBS, yung Union Bank of Switzerland. Pinag-aralan po yung case ng Cainta sa pag-roll out at pag-implement ng infants and toddlers na talagang sisimulan natin sa awareness ng mga magulang. So during last year po, wala pa silang enrollment ng infants and toddlers. Pero nung ginawa po ng mga teachers at sa tulong po ng ECCD Council sa pagtitrain sa mga teachers, ngayon po nakapag-pa-enroll na sila ng maraming estudyante on infants and toddlers. And through that po, nagkaroon ng awareness ang mga magulang natin kung gaano ka-importante yung first 1,000 days at gaano ka-importante yung participation nila sa development ng kanilang mga anak. Ngayon po, we are developing a module and resource guide for the first 1,000 days. Isa po sa na-create namin na learning guide or learning material is yung FME flashcards. Ito po ay tungkol sa father and male engagement. Kasi katulad nga po yung findings natin, kailangan mas strengthen yung participation ng male caregivers sa mga bata natin. So ito po ay i-include namin sa aming programa sa infants and toddlers para po ma-educate din yung mga male caregivers. So sa experience po namin sa Cainta at sa Batan, Aklan, naging successful naman po yung participation ng community with the help of the LGU, with the help of other NGOs po, katulad ng ARNEC and ng UBS and ng More for Care movement, naging aware po yung mga parents from Cainta and Aklan. Ngayon po, patapos na yung study and magkakaroon po kami ng paglalagom ngayong December tungkol sa mga experiences namin sa Cainta and Batan regarding the awareness and the participation of parents sa ating infants and toddlers early development program. Marami pong success stories.
Yeah, thank you, Ma'am Tess. At hopefully next year, pag tayo ay magkaroon ulit ng ganitong pagpupulong, ay meron na po tayong mas marami pang maikikwento tungkol sa mga success stories na ginawa na natin sa mga areas na ito. Thank you po. And now we have a question from Ms. Jeneline Villena of ADB. This is directed to our authors, Dr. Val and Aaron. How did you define exposure to parental violence? Are mild scolding and cold treatment included? Ayan. So, kailangan ma-define natin parental violence.
Yes. So, dun sa dataset ng LCSFC, there are several questions about violence. First, tinanong yung mga bata kung naka-experience ba sila ng physical violence from parents. Una, yun yung isa sa kasama. Pangalawa, hurtful violence by parents pa din, physical hurtful. So, we lumped it together so we can get the physical aspect. And then the emotional aspect naman, may question din on that. And to answer the question dun sa mild scolding and the other one mentioned, it is in the discretion of the children given how they perceive yung violence. Given the enumerators ask, do you experience physical violence? So it depends on how the respondent perceive what is violence for him or her. So yes, it's included.
So,
Dr. Val.
Miss Mel, I think yung again, I think this boils down again to the nature of the construct, na sobrang hirap niyang i-measure. And I think Dr. Rin was smartly describe these variations now when it comes to measurements. But I think I think the most important word here is yung hurtful, no? So when the child um, perceive na the physical or uh, emotional violence was hurtful or that relationship was hurtful. So I think yun yung uh, uh, importante po dun. No? So again, similar to what Aaron mentioned, it's really up to the child on whether he or she perceived it as hurtful.
So, pagka pala papaluin yung bata, kailangan i-explain, ganon. Kasi kultura natin yung namamahalo talaga karamihan ng mga magulang, di ba? Okay, so another question, this is for Maddie from Dr. Maria Asuncion Silvestre of Kalusugan ng Mag-ina Incorporated. You mentioned 3 breastfeeding indicators, exclusive breastfeeding and continued breastfeeding at 1 and 2 years, but not the most crucial one, breastfeeding initiation within the first hour. All 4 indicators significantly declined in the 2023 National Nutrition Survey. In the PSA, National Demographic and Health Survey, skin-to-skin contact is also used as a reliable proxy indicator due to high maternal recall. May we ask for your comments on this, Maddie?
Yes, thank you for that question. Actually, I apologize for the oversight, but as we were writing the paper, I think the main point we were trying to drive was how stunting was prevalent in the next 1,000 days, which can be attributed to deviations from proper infant and young child feeding practices. So I wasn't able to include that particular indicator, but you're right, Dr. Sylvester, about it being a really important indicator for breastfeeding. So apologies po.
All right, thank you, Maddie. So we're down to our last question. So anyone may answer, but I'd like to start with Dr. Hirin and Ms. Tessa first. So this is from Ms. Leslie Joy Diaz of UP. The studies on violence against children and the next 1,000 days highlight the importance of proper parenting and the need for wider parenting education. Ika nga, it takes a village to raise a child. Given this, what policy or legal changes would you recommend to reduce long-term parental absence due to overseas work and ensure that Filipino children receive consistent, nurturing care throughout their growth and development? So this relates to our OFWs, ano? So Dr. Hirin, your thoughts, please.
That's a difficult question. The answer is macro in perspective in terms of how the economy develops and employment opportunities locally and abroad and so on. So maybe other than that, perhaps the interventions should be a little bit more focused towards what if they do go and there's absentee parents, how can the family cope with that kind of absentees? Because they do bring in resources for the family that allows them to live. So what are the kinds of initiatives that would help those who stay behind and the children who stay behind to cope with that absence? And how do you still increase the communication between those that are absent and those who are left behind? So that constant communication between parents and children, even if they are abroad. So maybe we look for a solution closer to home than maybe rearranging the economy, which that's a global situation to start with.
Thank you, Dr. Hirin. It's really difficult for a parent, no, to be leaving your kids behind, but sometimes yung economic aspects of it, kailangan talaga masuportahan din naman. So, Ma'am Tessa?
Okay, so yun ang realidad ngayon sa ating bansa eh. Talagang ang daming absentee absent parents. Pero may naiiwan. So, hindi natatali sa parents lang. Paano kung wala ang mga parents nga? So, may naiiwan na permanent or alternate caregiver. So, yung pong tagapag-alaga ay siya yung nag-umako sa pag-aalaga ng mga bata. Ngayon, how to address this problem? I think we should have a strong parenting and caregiving program na makakasgate po talaga down to the LGUs, down to the barangay. It's high time to have an integrated program on parenting. Hindi lang po naiiwan yon sa ECCD, sa centers. Kung hindi, magkaroon na po tayo kasi ang DSWD din po ay may parenting program. So we have to strengthen yung parenting program which is integrated. We need the strong participation of the LGU kasi sila po talaga din yung mag-i-implement at mag-i-implement effectively. Kaya nga po malaki ang role ng DILG ngayon sa pag-implement ng ECCD services and programs. So what do I suggest is a strong and integrated program on parenting and caregiving. Kasi seryoso na po yung ating mga nagiging problema and alam natin na ma-address yung concerns ng mga bata dun sa first 1,000 days and the next 1,000 days, siguro po malilesen yung problema natin in the future. And we are assured of having citizens who will run our country, our society perfectly, or kung di naman po perfectly, ay maraming makaka-thrive at makaka-survive. Yun lang.
Thank you, Ms. Tessa. Thank you, everyone, for the fruitful discussion. As much as we want to do more, to answer more questions, unfortunately, we don't have much time. We actually received over 30 questions on Zoom. Some of those were answered na. But don't worry, our webinar team will consolidate all your questions and forward them to our panelists for their response. So we will email the answers to you as soon as they become available. So before we officially close the open forum, let's hear some brief parting messages from our presenters and discussants. Let's start this time with Dr. Val, and then Aaron, then Dr. Hirin, and then Ms. Medina.
So again, thank you po again. No, so these I just want to mention po no these two studies are part and parcel of a bigger effort po ng PIDS to really understand nutrition and parenting. No, so I think in the last 2 years we've published, I would say, more than 10 papers on nutrition, and part of that also is parenting, because we really want to understand this very complex and context-specific issue on parenting. No? And I think one of the studies po na nakita namin is, this is related to the last question, no, na a big portion of a big portion of children are not only being cared of by the mother or the father, but also their grandparents, their sisters and their brothers. No, so and this is again related to yung mga umaalis for OFW, na OFW. No, so again, it's a very complex thing in the country that we really need to examine it. And the PIDS, we really want to understand this so we have a more nuanced and a more contextual policy prescription. No? And again, I would like to thank Dr. Hirin. Dr. Hirin is always our partner. Thank you again, Dr. Hirin, for giving us your wisdom and your guidance. No? And also ECCD Council for the current partnership and future partnership. No? And to Aaron and Maddie for presenting this important tour. Again, it's just part and parcel of a bigger effort of PIDS to really examine nutrition and parenting. No? So again, and thank you also to the team of Ms. Mel for mounting this event. No? Thank you, and to all our listeners, and a lot of them are also our partners, Mamian and Dep and sino pa. So everyone po, no, so for supporting our research program on nutrition and parenting sa PIDS. So maraming salamat po.
Thank you, Doc Val. Aaron?
Hello. So, for me, maraming salamat po no, sa discussion na to, especially kay Dr. Harry. It's a pleasure to work with you on this. And um, I would like also to be thankful about the data that we've been provided, no, the LCSFC data set and the insights from Dr. Herring again, na we can leverage it more, the data, and explore it deeply, to provide um, evidence-based results and discussion points in the future. So, yun lang po yun sa akin. Maraming
Thank you,
salamat po.
Aaron. How about Maddie first? Maddie?
Yes, also thank you for this discussion. Very grateful to be a part of this study also. And I think as a nutritionist, we were very deep into the discussions of the first 1,000 days, and through this study, I've learned more about the next 1,000 days and how the other components of nurturing care, like responsive caregiving, learning opportunities, and safety and security are important to sustain what we are starting to accomplish with the first 1,000 days. But I know that there is still a long way to go for both the first 1,000 days and the next 1,000 days. And I'm very glad that the ECCD Council is very much aligned with our vision and our direction for early childhood care and development. So that's it. Thank you.
Thank you, Maddie. Dr. Herring?
Yeah, let me just follow up on this issue of parenting and follow up what Val was mentioned, the importance of information regarding the child in terms of the physical needs in particular. I said that early detection and diagnosis of hearing issues, sight issues can be important in how to deal with the children. But also probably important are the developmental needs. The child might be unruly. The child might not be able to concentrate. And that is an occasion where parents or caregivers punish them or get mad at them and lead to some kind of violence, when in fact there's a developmental need for that child. And also, just like the physical needs, those things can be detected early. I think we don't need the psychiatrists at the moment or the developmental pediatricians, but I gather that some of the symptoms can be detected early, and parents and teachers can be taught to detect those kinds of symptoms so that they can report and refer and then take care of those child, because that might be the basis for some of the violence, because they don't understand why is this kid unruly, don't listen to me, and things like that, when in fact he has some developmental issues. Over.
Thank you, Dr. Herring. Miss Tess?
Okay, sa pagtatapos po, katulad po nung cliche na lagi nating naririnig, it takes a village to raise a child. Kailangan ng isang pamayanan o ang buong pamayanan para palakihin ng mga bata. Maging bahagi po tayo nun, sana lahat. At hayaan natin at tumulong tayo sa pagpapaunlad at later on sa pagiging matagumpay sa buhay ng mga batang at entrusted sa atin. Muli po from the ECCD Council, ako po si Ms. Tessa. Maraming salamat po for this opportunity.
Thank you, Ms. Tessa. Thank you to our presenters and our discussants for today's very insightful discussion. What my take really is that there are policies, some funding, improving naman tayo on that part, that's good. But the real test is whether these translate into actual changes in parenting, child safety, and support especially for the poorest families. So if implementation is weak, all the early gains highlighted by PIDS today will also disappear. So we all hope na maging mabuti, maging mas maayos ang ating implementation ng mga policies na ito. So once again, thank you very much to our panel for the valuable insights and to our audience for their active participation and for staying until this time. So let us give everyone a big round of applause. I will now turn over the virtual floor to Janina for the closing reminders. Thank you, everyone.
Thank you, Ma'am Mel, and to all our presenters, discussants, and guests for joining us in this productive and insightful session. Before we officially close, we are pleased to announce today's raffle winners. For those joining us for the first time, the PIDS team selects 2 winners from our Zoom audience and 1 from Facebook. We prepared special tokens for you as our way of saying thanks for being part of today's event. So from Zoom, our winners are Mark Benjamin Piazon from the World Health Organization Philippines, and Maricris Baldo from the Philippine Malabon Cultural Institute. From Facebook naman po, ang ating pong winner ay si Miss Maria Norma V. Zamora. So congratulations to all of the winners. The PIDS Tech Team will coordinate with you on how to claim your prize. So don't leave us yet, as we have a few reminders. The speakers' presentations will be available at the PIDS website from the link provided in the Zoom chat box and Facebook comment section. To our Zoom participants, please help us improve our events by answering our feedback form through the link provided in the Zoom chat box. The e-certificate of participation will be sent to your email automatically after submitting the completed feedback form. For our Facebook Live viewers, as mentioned earlier, you can earn your e-certificate po through our Replay on Demand feature. Just scan the QR code or click the link in the comments to answer the pop quiz. And please submit by 10 p.m. tonight to qualify. Keep in touch with us as well. Follow PIDS on social media. Also, feel free to visit our websites for more information. We hope to have you again at our future events. Please visit our webpage, www.pids.gov.ph/events, to learn the details of our upcoming events and register. As we come to the end of our webinar, we sincerely thank our speakers for sharing their valuable insights and for helping us understand the critical role of early experiences in shaping Filipino children's development. We also thank all participants for your active engagement and thoughtful questions. It truly enriches our discussion and helps us collectively think about ways to support children in their early years. We hope that today's discussion has provided you with meaningful knowledge and practical strategies that you can apply in your work, home, or community. Please keep an eye on your email for the webinar recording and additional resources. Once again, maraming salamat po for joining us, and we look forward to seeing you in our future webinars and initiatives focused on nurturing the potential of every Filipino child. Stay safe po and have a wonderful day ahead.
Thank you.